Now, we've heard a lot about Remdesivir. It's that promising drug for coronavirus, but can people get it? And what about another treatment that you might not know about?
Joining us now to give us his perspective is Dr. Nicholas Testa, Chief Medical Officer with Dignity Health Southern California. Good morning to you, and thanks again for joining us.
Thank you for having me.
All right. There's been a lot of conversation about the drug Remdesivir. Can you tell us more about it, and do you think it will be more widely available since the clinical trial ended?
So Remdesivir is an interesting drug. It was initially developed to treat Ebola. And we've seen our first large study in the United States where we've seen an acceleration of disease recovery by about 4 or 5 days. So, this is really promising. The FDA has moved Remdesivir from being a research drug to now being in the category of what is emergency use allocations. So that's good. So we have more access to it now. It doesn't have to be in a research trial. The challenge is FEMA is now controlling the distribution, so we are yet to see it in our hospitals, but we anticipate within the next week, FEMA will declare how they're going to be sharing it with the affected areas.
Just another quick question about Remdesivir. You talked about Ebola. It didn't work. I mean, how often do we find a drug that failed in one area, but then suddenly is successful in another?
That's a great question. It actually happens not infrequently. These drugs are out there, and there's a lot of antivirals out there. So for us to try it again and have it be effective. Now, how effective it is, we've only seen the first trial. So that's why it's still in this sort of experimental stage, but it's showing enough benefit that we're optimistic.
Now, convalescent plasma is another treatment that has shown promise. What's been the biggest challenge in terms of getting donors?
So let's rewind that a little bit. Convalescent plasma is fascinating because it's been around for hundreds of years. The challenge is that it works because you have a patient who has recovered from COVID-19, and then what we do is we take their blood and we spin it. So we just have the antibodies to fight the infection, and we give it to another patient who's infected. The challenge is you got to find those donors. So now we have 27,000 people who've been infected in our county. Those are all potential donors. So the Dignity hospitals and a lot of the other hospitals in Southern California are actively creating donor programs. So those patients who recover and we discharge, we make sure we get them back so that they can donate, and then we can use that plasma to treat more patients.
But then again, you're talking about immunity to a person who's had it. We don't necessarily know yet if people are immune. So let's talk about herd immunity. I mean, everybody wants to reopen. We talk about all of these people that have had it. Do we know? What do we know with this?
Well, so herd immunity is interesting. So the concept of herd immunity is that you have so many people infected in a population that the disease no longer spreads, because if one person gets it, the majority of people around it have already been immunized to it. The numbers look like we need about 70% of our population to be immune for us to stop the spread of COVID-19. Here's the challenge. If 70% of our population gets infected, the mortality rates associated that would be shockingly high. So right now, the only way that herd immunity is really going to work for us is if we have a vaccine that can drive that herd immunity.
Got it. All right, Dr. Nicholas Testa, thanks once again, for joining us this morning. We'll see you again.
Always my pleasure.
Okay, thanks, Dr. Testa.